Well, I've been coming to Canada many times over many years, so I knew that family medicine was very strong in this country. I knew that there were some fantastic academic leaders in family medicine, both in the past and also present. And at the time that I was approached about whether I might be interested in this role, I'd just finished my second term as Dean at Flinders University in Australia and was looking for a new challenge. And I also was just finishing up my time as president of WONCA, the World Organisation of Family Doctors. And I was wondering how could I use the experience that I'd gained in global family medicine in a new role. And this role came along. And I came for a visit at the invitation of the Dean and met a lot of the faculty and thought, what an amazing department. What wonderful people, what great work is happening here. And I put my hat in the ring and I was fortunate enough to be asked to become the new chair. Yeah, this is a very strong academic department of family medicine, one of the strongest and one of the largest departments of family medicine in the world. And it has fantastic research, it has a very good international reputation for the quality of the education being provided, and there's a lot of innovation happening here as well. And also there's, and this is not just in Toronto but across Canada, a real focus on global health and social accountability and the contributions that we can make in the development of family medicine in many other countries in the world, especially lower middle income countries. So I think that this department stands up very well against other departments in Canada and North America and around the world, and my aim has been to strengthen that even further. Well, I'm not sure that there are many challenges in a negative sense. There are positive challenges that we need to focus. How do we continue to grow our research productivity and the impact of the research that our faculty are carrying out? How do we continue to strengthen the education programs that we're providing and make sure that the standards remain very, very high and that we're actively involved in research around education as well to continually strengthen and improve the work that we're doing? How do we support our medical students and our residents and our junior faculty in the development of their careers and support those who are interested in joining us in a career in academic family medicine, whether that's teaching or research or involved in many of our other activities? So there's lots of challenges, and but they're all very positive things to be able to tackle. I think that the achievements that I've been really proud of are achievements of the entire department, achievements of our faculty and our residents and the staff who support the great work that we do. I was very pleased when the World Health Organization provided designation of our entire department as the new World Health Organization Collaborating Centre on Family Medicine and Primary Care, the very first WHO Collaborating Centre specifically focused on family medicine in the world, and that provides both recognition of the great work which has been happening over so many years in global health in this department, but also provides wonderful opportunities for this department and our faculty and residents to be actively involved in supporting the WHO in developing global healthcare policy and the rollout of healthcare programs, especially in lower middle income countries and especially in neighbouring countries in the Americas. I've also been very proud that we put ourselves forward for global accreditation of our residency training program in family medicine against the standards set by the World Organisation of Family Doctors, WONCA, and we had an international team come and visit Toronto. They visited several of our academic sites. They met with many of our residents, many of our faculty, looked at our curriculum, our training, our standards, and the whole elements of our residency training program, and we're very impressed and provided us with global accreditation. So we're only the second family medicine residency program in the world to receive that global accreditation from the World Organisation of Family Doctors, and that was a fantastic credit to all of our teachers in family medicine, all the people who are involved in our residency program. Again, over many years, long before I came to Canada. So they're just two examples, but there's so many other things happening that I'm really proud of. I'm really impressed with so much of the research activity which is taking place, and in 2018 our researchers in our faculty attracted more than $15 million of research funding, competitive research funding, to support really important research on family medicine and primary care, and the outcomes of that research activity is going to help continue to improve family medicine right across this country and have impacts globally as well. The quality improvement programs, which are one of the hallmarks of this department, are really impressive as well, and it's been wonderful to be able to initiate the Toronto International Conference on Quality in Family Medicine and Primary Care, and to bring the world here to Toronto to see what we're doing, and also to allow us to learn from initiatives and innovations which are occurring in other parts of the world as well. Finally, I'm really pleased with the work that we're doing around social accountability and making sure that our residents are aware of their responsibility to their individual patients, but also to the communities where they work. One area that I'm very pleased that we're getting some traction in is looking at how we can improve our contributions to Indigenous health in Canada. When I arrived in Canada, the Truth and Reconciliation report had been released, and I talked to a lot of our faculty and residents, talked to our Indigenous faculty members about what this department could do to contribute to that national process. And we decided that we'd like to become the family medicine residency training program of choice for Indigenous medical graduates from across Canada. And then we set out to look at how we might do that. And so we've looked at how do we support our Indigenous residents and our Indigenous faculty. How can we increase the number of Indigenous people who are working with us in our training programs? How can we increase the experience for all of our residents? How can we ensure that all our faculty and residents are engaged in learning about cultural sensitivity and cultural safety and cultural awareness? And this has the capacity to transform the work that we're doing, but also contribute to improvements in family medicine and hopefully improvements in the health and well-being of the Indigenous people of Canada, and also lessons which we may be able to share with people in other parts of the world as well. So there's lots of things to be really proud of. I've only touched on a few of them, but this is a wonderful department. It's full of amazing people doing wonderful things, and as chair I have the job of helping to facilitate and support those wonderful people doing the great things they do. This department has had a remarkable contribution to family medicine across Canada and to the health and well-being of the people of this country for the 50 years of its history. And that's been predominantly through our work in training the next generation of family doctors, through the experience and exposure to family medicine that we provide to our medical students, and the wonderful role models who they get to meet and work alongside during their training, and then through our wonderful residency training program in family medicine and our special advanced skills training that we offer to many of our residents as well. And through providing wonderful educational opportunities, through providing the opportunity to work with wonderful family doctors in great family medicine teams, through providing the opportunity to experience family medicine in a variety of locations, both in urban Toronto, in rural areas and in remote parts of Ontario, as well as for some of our residents in other parts of the world. We're helping to train the next cohort of family doctors and making sure that that next cohort of family doctors is well trained, well experienced, that they understand the breadth of family medicine, that they're great communicators with their patients, that they're wonderful clinicians, that they appreciate the challenges that face family doctors and are able to tackle those and ensure that everything they do actually improves the quality of care that they're providing. So we're having an impact every day through our residents, through our alumni, through our faculty, on the health and well-being of the people of this country. And that's a pretty remarkable achievement. Well, I believe this is actually the start of a golden era for family medicine and primary care, not only in Canada but all around the world. Countries all around the world are starting to understand that if they want to ensure that they can deliver health care to everybody in their country, to every person, whether they're rich or poor, whether they're in the city or the country, whether they're old or young, whether they belong to marginalised or vulnerable populations. If you want to deliver health care to everybody, you have to have a strong healthcare system based on strong primary care. And in many countries, the basis of primary care is family medicine. It's the work that we do as individual family doctors. It's the work that we do with the members of our family health teams. It's the work that we do integrating our care with the care of other specialists, with other healthcare services, with the hospitals in our communities as well. And as countries around the world are starting to appreciate that they really need to be investing in family medicine and primary care, we have opportunities because we have such a strong system here in Canada already. Now, I'm not saying that we can pick up the Canadian model and plonk it down in other countries around the world. That would not be appropriate. But what we can do is to assist people to come and look at what is happening and how we deliver family medicine and how we provide our training and how we do our research in this country, and people can take away great ideas and they can take away the elements which they feel are going to actually help them to develop resources in their own nations. And we can provide advice if we're invited, but also through other people coming and sharing with us about what's happening in their countries, we can pick up new ideas which can help us to strengthen what we're doing as well. So we're part of a really important global movement to ensure that healthcare is finally available to everybody. And this is what the United Nations is calling universal health coverage, and the United Nations and the World Health Organization say we won't have universal health coverage unless we have primary health care. And we won't have primary health care in many countries unless we've got a strong system, like we have in Canada, of strong family medicine, providing health care to all people. So 2019 is a really important year in the history of the Department of Family and Community Medicine here at the University of Toronto because it's our 50th year, our golden anniversary, and it provides an opportunity to look back and to reflect on how this department developed, to remember many of the amazing family doctors who founded and helped to grow this department over its first 50 years, but it's also an opportunity to look forward to the next 50 years and beyond about how we're going to continue to grow our academic department, how we're going to grow our academic discipline, how we continue to support our medical students, our residents and our faculty and everybody who wants to engage with us in strengthening family medicine for the people of Canada. So I'm very excited about the program of activities that we have for the 50 years, but even more I'm excited about what comes next and excited to hear the ideas of our faculty and our residents and the rest of the university about how we're going to grow family medicine even more. We're currently the second largest department in the Faculty of Medicine here at the University of Toronto, one of the largest academic departments of family medicine in the world, but there's still so much more that we can do, and I want to see growth in our research. I want to see growth in the educational opportunities that they're providing, growth in the opportunities for graduate students to be doing masters and PhDs with us here in Toronto or at a distance in other parts of the world. I want to see a growth in the contributions that we're making through our global health and social accountability work. I want to see continuing contributions to the critical issues which are healthcare issues which are facing our community, both here in Toronto, in Ontario, in Canada and around the world. And I just think it's an incredibly exciting time to be involved in family medicine. The world has so many big health challenges with ageing populations, with inequity of access to healthcare, with the rising chronic diseases, with continuing threats from infectious diseases, communicable diseases, with challenges in mental health and well-being, and with governments all over the world looking to ponder on how can we continue to provide healthcare and afford to provide the healthcare that our population is demanding, and especially at a time when information is available to everybody and the knowledge and awareness of the population is growing through access to digital means and so forth. And these are challenges, but they're also challenges that I think that we can be part of addressing, because I think the solution to many of these great health challenges lies in strong family medicine, and that's what we're doing, and that's what we'll continue to do. Happy 50th anniversary to everybody at the Department of Family and Community Medicine.